Right, here is your question.
Okay.
Right, so if you've read and understood, considering it critical care scenario, please tell me how would you manage this patient?
This patient post-op day 4 total thyroidectomy. I will manage here according the CRISP protocol that include airway management and check it if it's patent or not. Also, I will supply with oxygen 10 to 20, 12 to 15 liter oxygen. Then I will check the breathing and check the the trachea if it's central or not, and auscultate the chest if and assess the airway, and also I will check assess if there is any pneumothorax or pulmonary fusion and chest movement and oxygen saturation. Also, I will take ABG to check her ABG. Then I will circulation. I will give her a normal saline and take a blood sample for her CBC, kidney function, electrolyte, including calcium level and vitamin D level and parathyroid hormone level. Also, I will do disability if the patient consciousness or any lateralizing sign or weakness in her lower limb. Then I will exposure for the whole patient and the wound itself.
Okay, did you
Yeah.
mention ECG monitoring or cardiac monitoring? Because
Yeah.
that you forgot. That is very important. Okay, in this patient, as the stem says, it was 1.7 millimole per liter calcium level. What should be the normal level, and what would you comment on this level?
It should be to the normal level between 2.13 to 2.6
Yes, and how
millimole
would
per
you?
liter.
Yes, how would you comment on this level that you have
The patient
checked?
have a hypocalcemia.
Okay,
It need and symptomatic.
okay,
For that, it need a management with 10 ml calcium gluconate, 10% over infusion over 10 hour, over 10 minutes under ECG monitoring.
yes,
Then I will assess the patient if it's the symptoms. If it's wind, I will keep her on in maintenance dose. If it's still symptomatic, I will repeat the infusion 10 ml for 10 ml, 10% calcium gluconate for 10 minutes, and then I will assess the symptoms. If it is symptoms went, I will repeat the calcium level after 2 hours. If it is still persist
okay.
pain, I will keep her on infusion calcium gluconate 100 ml over 1 liter with a rate of 50 ml per hour.
Okay, thank you.
Yeah.
Can you please tell me why does the patient presents with hypocalcemia post-operatively, post-thyroidectomy?
It could be iatrogenic removal of parathyroid hormone,
Yes,
parathyroid gland, or ischemia to parathyroid gland.
very good. All right. Please tell me how this calcium is present in the body.
In the body, 99% of the calcium is in the bone and 1% in the fluid.
Is free in the
In
blood,
the
yes.
in the free in the blood. In the blood, it is 50% is bound to some blood component, or 50% is the free calcium ion.
Yes,
50% of the calcium bound to
blood.
substance to protein,
Yes.
45%, and 5% to the citrate or blood salt. Yeah.
Why? why do we need calcium in the body?
They have multiple function, like
Yes.
for bone metabolism
Yes.
and formation, also for smooth muscle and cardiac muscle and skeletal muscle contraction. Also, it is act as a neurotransmitter.
Yes.
Also, it is a component of coagulation factor.
Yes. And needed for
Uh,
the cell division.
and need
Okay.
for cell,
All
cell
right.
division.
Okay. Please tell me, which hormones are involved in the regulation of calcium?
Parathyroid hormone,
Yes.
vitamin D, and calcitonin.
Okay. Right. Please tell me, what are the physiological role of calcium in the body? Name four at least.
Physiological role of calcium in the body.
Yes. You need calcium for muscle contraction and
Muscle contraction and for neurotransmitter
yes,
and uh, and coagulation.
and activation of enzymes, glycogen metabolisms. Yes, many of these. All right. Why does a patient with hypocalcemia presents with shortness of breath?
Shortness of breath. It could be uh, affection of uh, why
Wait,
he's yeah.
its answer is in front of you. There is tetany, as you could see. So,
Mm.
which two
Affection.
muscles? Yes,
It could be affection of the laryngeal muscle
very good. Yes, which
and
can
or
cause
the
upper,
diaphragmatic muscle.
yes,
Mm.
upper airway. This laryngospasm can cause upper airway obstruction. That's why
Obstruction. Yeah.
you're worried about it. Okay, what are other signs of hypocalcemia that you should know about? Two signs.
Car- Carbobedal spasm
Yes,
or
but
facial Chivo-stick sign. Chivo-stick,
yes,
it is a
yes,
tapping over the facial nerve,
yes,
lead to contraction of facial muscle, or Tourniquet sign that tapping over the median nerve due after the inflation of a sphingomanometer over the
yes,
upper limb, it lead to carbobedal spasm
yes.
and twisting of the numbness of oral
Okay,
muscle.
please tell me the role of vitamin D or the metabolism of vitamin D in calcium
Metab-
hemostasis. Why do we need
why?
vitamin D for calcium hemostasis?
Vitamin D have a role on the bone and in the GIT and renal.
Yes,
In the bone, it increase the in the renal, it increase the absorption of the calcium and excretion of phosphate. On the GIT, it increase the absorption also of the calcium from the GIT, and in the bone, it lead to bone formation, bone calcium deposition.
yes.
Yeah,
Okay, right. How vitamin D is metabolized or how is it formed?
formed. It's in the exposure of the skin to
Yes,
the ultraviolet rays of the sun
yes, yes,
lead to a change of 7-dehydrocalciferol to a pre-vitamin D3. It is called the
cholecalciferol
cholecalciferol.
D3. Yes,
Then cholecalciferol in the renal, it's by hydroxylase. It lead
yes,
to formation of one hydroxy one hydroxycholecalciferol. Then
yes.
it go to the liver where it do hydroxylation in the 25 hydroxylase. It lead to formation of one 25 dihydrocholecalciferol, which is active form of vitamin D.
All right. How much vitamin D is required every day?
It need 1000 vitamin D,
No, less 600 international units
600,
per day.
600.
Yes. Okay, good. Right. Thank you. Okay, one last question. What are the signs of hypocalcemia that you should know about or one should know about?
Carbobedal spasm.
Yeah, these two you told me. Then again,
Yeah. And maybe convulsion,
conversion.
also
Yes. Okay.
nausea and vomiting.
Okay.
Also, it could be lead to
What about on
irritability.
ECG? If you do
Irritability.
ECG, what would you look for?
It lead to prolonged of your QT interval.
Yes, and arrhythmias as well.
Arrhythmia, yeah.
Right, good. Thank you. Right, thanks.